There we go. Yeah. Great. Well, welcome to Friday's Report Out. It's really good to see you all. Delighted that we've got some really positive updates and excellent in terms of Lean for Leaders certification. So looking forward to that. So let's get on with proceedings, and I'm delighted to introduce Deborah Ty, Partner Manager for the Partner Programme. So Deborah, over to you.
So we've wanted to come and tell you about our programme where we involve interested members of the public in our quality and safety work for a while. In our programme, we have 15 partners who have a vast range of experience between them. Most of them are or have been patients at our hospital, but they also bring experience of living with long-term health conditions, sensory impairment, being of a BAME background, or having different secular and religious beliefs. Today we have 3 of our partners with us, Liz, Les and John. They've joined us not only because it's the right thing to do, but also to demonstrate how we have reimagined and redesigned how we involve members of the public in our work. Alongside us are Dr. Anna Winfield, Associate Specialist in Quality, and Christina, Head of Patient Experience, who had the vision for members of the public, be it patients, carers, or those who live nearby, to be present as equal members of the team, where options are discussed and decisions are made about improving quality and safety of patient care. They wanted to do this because key reports such as the Ockenden Review and Morecambe Bay tell us that listening to our patients, carers and the public and acting on their insights is the right thing to do. Involving partners is a demonstration of how we are living our trust values of being patient-centred, collaborative and empowered. And by inviting partners to join our quality improvement and safety work, we can achieve our trust goal of being the best place for patient safety, quality and experience. The reason being that our partners help us focus on the patient, carer and public concerns and priorities. And lastly, members of the public embedded in decision making are found in outstanding organisations. I'm now going to hand over to Anna. Next slide, please.
Hi everybody, I'm Anna, I'm one of the geriatricians at LTHT. So this is how it started, our partner programme. So as you can see, the first experience we had in the trust of working with a member of the public in the way we'd later call a partner was with our Falls Collaborative, and it was really illuminating, taught us a lot of information, especially with regard to what comes next, and it whet our appetite for what might be possible. It was the acorn from which a tree grew, and we can now move on to our next slide to see an explosion of what is happening now. So if you click on the next slide from there, please, Jimmy. Thank you. So you can see here, there's lots. This is a very busy slide, but this is where we are now. Currently, we have 14 partners who are embedded across a range of activities in our trust. They don't not only support our quality improvement collaboratives, but also varied other activities such as the Drugs and Therapeutics Forum, staff recruitment, namely consultant recruitment and so on, our patient safety framework discussions, the transformation board for unplanned care, etc., etc. I will not continue with the full list. We've managed to recruit people all across Yorkshire, as Deb has said, with rich, diverse backgrounds, different protected characteristics, who all bring a rich and diverse experience to their contribution and working with us in the trust. And in fact, our approach has proved so successful that demand for a partner is now growing beyond supply. So we're seeking further investment and funding to expand our management team responsible for this work, so we can continue to recruit and double our partner numbers to support more of our quality work in the organisation. So I'm now going to pass on to Christina, who's going to tell us a bit more. If you could go on to the next slide, please.
Hello everybody, my name is Christina. So this is a KPO report out, and KPO report outs are all about learning and how we've developed. And it would be fair to say that throughout this whole process, it has been one complete process of learning. And I would say that everything we've done has been centred around an awful lot of different PDSA cycles, and we've been hooking in with our partners, we've been hooking in with our staff the whole time to gather the feedback needed to help us to constantly understand what we need to put in place to make this even better. In fact, our partners were recruited. Part of the recruitment conversation was about saying to them, you know, we're absolutely not experts in working with partners. We're not sure even that we know how to do this well. And you are part of a big experiment to help us get this right. And actually having that conversation up front was imminently helpful, and it's meant that the partners have come on board with us in a way that we wouldn't ordinarily work with members of the public. So it's been absolutely brilliant. So the slide you've got in front of you has got an awful lot of key learning points on it that have come out of this work. Just going to concentrate on a couple of them. The first is that we've learned that a good induction is key to supporting our partners to work with us. We're continually learning what this should look like and tweaking the programme around that. But essentially, we've learned that our partners absolutely need to understand how to work with us in the trust. Our business is curious. The way we go about doing it is curious. Our language is curious, and a big part of what we need to do is to help them navigate that. We've put forward a whole heap of training. We thought at the beginning of this process that we were asking our partners to undertake rather too much training and they would find it onerous. But actually, what we've learned as we've gone along is that there has been a thirst and an appetite for more learning, and that everything that we have made available has been absolutely embraced with open arms. So the whole piece about induction and training has been really important. Finally, I just want to raise that we've really learned that one of the important aspects of this work is to ensure that when partners are embedded at a local level, they have a key contact within the work that they're engaging within, that they can link to, a member of staff. And the role of that person we've determined should be to support the partner, to help them navigate the meeting, to champion their role, to act as a contact for queries, and to really enable them to operate as best they can and to function effectively in that space. Now, so far, we've utilised predominantly the clinical leadership fellows in the organisation to undertake that role because they've been embedded in QI collaboratives anyway. We know going forward that's not sustainable because our ambition is to have so many partners across the organisation that the CLFs we've got in place actually wouldn't suffice. So there is a whole heap of work to do going forward in terms of what will be our model, but our key learning around this is that we need that. Thank you very much. Next slide, please, and I shall pass you on to our partners.
So I've got a feeling that John hasn't made it across to the meeting from our previous meeting. I don't know if it's a problem with the link. So I'll just briefly summarise, unless John, you are here. So I'll just briefly summarise what John said about 5 minutes ago when we rehearsed this presentation, there's points on the slide really sell themselves really. So a critical friend, it's about a long-term relationship, it's about meaningful involvement. It's not just popping in and answering a survey to say yes, that reads okay. It's about building up a relationship between the trust and members of the public who can actually challenge the way we're doing things and say, hang on a minute, is this right? Have you thought about this? And have the confidence to be able to do that. License to ask the stupid questions. They're not necessarily bound by certain cultures in various different departments, and they're able to say, actually, have you thought about it this way? This might seem really obvious, but what about that perspective? And the critical friend, so they're part of our team, but they're also able to support us, add advice, expertise, and these individuals are people who have got countless skills and experience that are a huge value to us at LTHT. Now, I'm going to pass over to Les next, and I hope that John might be able to answer, add a bit more if he's able to join. So Les, over to you. If you could move on to the next slide, please, Jim.
Thanks, Anna. Thank you, Anna. My name is Les Holbert, and I'm a QI partner with the HCAI Collaborative. So what does that mean? I'm a stakeholder in the Healthcare Acquired Infections Collaborative, which is made up of infection prevention control nurses, pharmacists, doctors, nurses, and clinical leadership fellows. The aim of the collaborative is to reduce bloodstream infections, for example, MSSA, MRSA, E. coli. So what's my involvement? I give a patient perspective. Leeds Teaching Hospitals is a patient-centred organisation. My background is I'm a transplant patient and have 32 years experience of LTHT services. I received the same training in QI as the medical teams, using tools such as appreciative inquiry and plan, do, study and act. The training was excellent, by the way. So what did I do? I joined the HCAI Collaborative in 2018. The first thing I did was to ask questions, not to be disruptive, but to understand. Work with the collaborative in a data capture exercise on cannula and catheter usage across St James's and LGI hospitals. Reviewed the data. The result was a need for a standard process for storing cannula and catheters. Also identified that updating documents such as the VIP scores helps reduce bloodstream infection. How does that improve the patient experience? Well, quite simply, yes, less needles means less pain, less discomfort, less disruption for patients, doctors and nurses. Saves time for nurses and doctors, releasing them to focus more on productive tasks. It was a positive experience. It increased the understanding of how important teamwork is and my role in that team. I got treated with respect, but the best outcome for the patient is what is desired. But in order to get the best outcome, we need to involve patient/carer in our QI strategy. This is exactly what the QI Partners program delivers. Work with CLF Clinical Leadership Fellows, Mikey Ewins and Katie Ward-Malanda. I asked them for some feedback on what they thought I brought to the table. And to quote, "It widened my vision and understanding of how patients can be involved in how we make improvements, and that it can go beyond the family and friends type feedback to actual involvement. It is a very different way of working." I'm also a member of the Quality Improvement Safety Group. So to summarize, the value of myself as a QI partner. I can make things better. There's no financial gain. True spirit of community service, or should I say service to the community, from a personal level, increased self-worth, confidence and social interaction. I can ask questions which generate debate and challenge the accepted norms and conditions. As a volunteer, I'm not bound by organisational culture and practice, but I'm free to ask to question the system, which a paid employee might see as career limiting. Experience, the tools and techniques which I've learned within the collaborative can be transferred into other areas to generate better outcomes for patients and staff. But last and not least, I can share my patient experience, both good and bad. I'd now like to hand over to my QI partner colleague, Liz. Over to you, Liz.
Hello, my name's Elizabeth Milner. I've been involved in quality improvement with the Trust for 3 years. I was one of the first in the role, and I was recruited by Anna and joined the Falls Collaborative after sharing a patient story. The collaborative showed a significant reduction in falls achieved through quality improvement work. And I was very proud when the collaborative won the Health Service Journal Quality Improvement Initiative of the Year in 2019. I feel I've been able to bring a valued patient, carer and experienced nurse perspective to the role. I'm personally a patient in 3 specialties in the Trust. I'm a cancer survivor, I'm a carer for a dementia patient and a brother with motor neurone disease. I'm also the mother of a doctor, so I have a broad perspective. Since the joining the the Falls Collaborative, as outlined previously, the partner programme has developed and evolved to provide a widening range of different opportunities for partners and staff engagement. Next slide, please, if possible. This is just an example of the things that I've become involved with as the programme has expanded. I've been working with Sophie and Catherine in the KPO team with 2 of my colleague partners to restructure the Lean for Leaders curriculum to make it more patient-centred. And there's been several foundation days where there's been very positive feedback. I've also involved in doing some KPO work with Rebecca Vickers regarding the physiotherapy patient referral pathways. I've recently, with another quality improvement partner, been privileged to observe 2 senior medical recruitment AAC panels. I found that extremely interesting. I think the rigour of it was extremely reassuring, knowing that consultants' consultants are in post a long time and are not easy to get rid of. The next thing I've been involved in is the partner programme project team, which has helped me understand how the difficulties of getting the work accepted. I've been involved with the chief registrar interview. I was actually an interview panel member. I was able to ask questions. Again, I found that, well, fairly nerve-wracking to begin with, but I really enjoyed the experience, and I understand from the candidate that was interviewed that they found that very positive too. I'm also been assisting with sepsis masterclasses as a sepsis survivor, and as somebody who's a parent with child with sepsis. I had a good understanding, and I've had very positive feedback about my contributions to that. And then lastly, I've had a long-standing relationship with the Dementia Steering Group for the Trust, and I'm currently now involved with some research that the university are undertaking to do with that. I'd just like to say lastly that I believe the progress of the partner programme from this 3 years is a remarkable achievement in view of particularly the operational pressures of COVID. And I do think it's testament to the willingness and the commitment of staff involved to keep this programme not only going, but expanding. So thank you for listening. I hope to continue in this important work. And I'd now like to hand over to Deborah.
Well, I've just noticed John's joined us. I don't know if we can go back 2 slides, Jimmy, to John's slide. John, I briefly summarised, that's the correct slide, thank you, Jimmy. I just briefly summarised this already, but I don't know if you just want to maybe give a little bit about your background, or John, you're on mute.
Sorry, okay,
you're back with us, yeah.
Yeah, apologies for that. Yeah, the comms problem, so sort that out. Yeah, really, these points are things I put together based on my experience over the last few years. So my background probably is relevant. I have a congenital severe visual impairment. Most of my career was in designing processes and digital solutions within the NHS and in local government. For the last 10 years or so, I've been the sole support for a highly socially isolated person with cognitive impairments due to a tumour. And over the last, in retirement, I've spent 4 years as a volunteer with Leeds CCG. With LTHT, I'm a member of the Parkinson's Collaborative. I worked on the RPIW for ophthalmology acute outpatients. I sit with the Unplanned Care Board, with the Was Not Brought Board, and I've contributed various other things along the way. And I'm a member of the Strategic Digital Board with West Yorkshire and Harrogate, the ICS. So a fairly wide context. And what I tried to do is to boil down to these key points to highlight the unique value that comes out of the public patient voice role 3. I've become a bit of an evangelist. Some people might have seen these already because it's taken from a one-pager document I've been flashing around to various people as I've been getting involved with various programs. And the 2 I'd have picked out here, one is the critical friend. It probably sums up the role of the QI partner and generally the patient public voice partner. And the one that's maybe a little less obvious is the ambassador role. It's a 2-way ambassador. On the one hand, we build relationships and confidence with staff, but on the other hand, we take messages back to those who are a bit sceptical, maybe had poor experiences many years ago with the NHS, and can help try to build in links there. So, and I must admit, blowing my own trumpet a wee bit, I'm I hope that including these points in the presentation we made at the HSG Awards maybe contributed a little bit towards LTH winning the award for service user engagement and co-production. Apologies again for my late arrival. This is totally down to technology, and although it paid my mortgage for 30 years, it still gets in the way at time to time.
No worries, John. If you wouldn't mind, Jimmy, advancing 3 slides, and we'll pass back over to Christina.
Oh,
sorry, Deb, it's you.
It's all right. Thank you very much. Thank you, John. You've heard about what we are doing. So what's going to come up next? Well, we know we have a good model to attract, involve and support partners. Our staff tell us that they enjoy working with our partners as it helps their job satisfaction because they know they are making changes that benefit patients with our partners' help. And you've heard from John, Liz and Les about the difference that they make. Therefore, we have the right grounding to set ambitious aims to stretch partner involvement as is described here. Our aims reflect where partners could bring their beneficial insights into our work. We have 8 aims, but I will just pull out a few. We've prioritised our aims for this year, as we know a key enabler to delivering our strategy is to understand the barriers to involvement and what staff will need, and that staff need support to develop the confidence to work with our partners. We are also prioritising introducing CSUs to partner involvement to help us achieve compliance with the NHS framework for involving patients in patient safety. And our third priority is to understand demand and how to respond to this. We are thinking creatively about developing relationships with local employers as a source of partners through their corporate volunteering schemes. We're also making some good progress with some of our other aims too. We have one partner on our Equality and Diversity Steering Group, and as you've heard from Liz, we have a partner helping us understand how they can join our senior medical and dental recruitment panels. And I will now hand over to Christina. Next slide, please.
So everybody, why are we here today and what do we want from you? So clearly today is about helping us celebrate this success that we've had, which clearly is just so wonderful and brilliant, and we're very excited by it all. But actually, just that you're here today learning about what we have to say, understanding the role of partners, we hope will enable you to start talking about partners back in your CSUs and in your areas of work, and raising awareness that we have this wonderful resource in the organisation. We are, as you've heard, seeking investment to enable us to continue the programme, but actually everybody on this call today can commit to supporting the programme, because as the work continues to spread and we introduce partners more and more into different areas of the organisation, we are really seeking everybody in senior leadership posts to get behind the principle of supporting our partners and identifying staff within their own local areas who can actively work alongside partners to embed them into their roles. And we're also asking everybody to consider going forward where partners might be appropriate to work alongside their business strategies and their strategic meetings. Because as Deb described, one of our strategic aims is to embed the role of partner into all of our CSUs. We will be coming to a place near all of you sooner rather than later, I'm sure, and it would really help for this conversation to have started locally and to really get people up to speed and thinking about the possibilities of working in this way. Thank you so much. We're really, really empowered and excited by this work that we've undertaken and all the learning that we've achieved, and we hope we've given you a flavour of that today. Thank you very much. That's the end of this report out.
Fantastic. Brilliant. Thank you. That was fantastic. Really, really good. Thank you so much to all of our partners. It is really inspiring, actually, and humbling listening to you describe the input, and really excited by the potential and the the achievements already, actually. So I'm conscious of time, guys, so I'm going to sort of press on, and questions and comments. Hopefully we might have a little bit of time at the end, but we're aiming for a 1:15 close. So I'm going to hand back to you, Christina, in terms of the patient experience team and the work on patient complaints. So over to the complaints team.
Thank you very much. Thanks, Julian. Next slide, please. So a completely different subject now. We're talking again about our wonderful complaints improvement programme, and here today to give you a final report out for the progress of cohort KPO2. CSUs that have completed that programme. But today I wanted not only to share their personal progress, but the success of the programme as a whole. It feels as though now that we're getting to the end of cohort 2, it's a good idea to stop and take stock and kind of consider what our improvements so far has been. So this slide is very busy, but I'll just cut to the chase. In the it tells us that in the 14 months up to the start of the whole project, so to the start of KPO1, the trust lead time was 2,808 hours for the responding to complaints. So what that means is the average time for the organisation to respond to a complaint was 2,808 hours. That's an awful lot of hours and way over our target. In the last 14 months, so this is the time that this improvement programme has been running through the 2 cohorts that have gone through it. This has fallen by an astonishing 33% to 2,172 hours. And whilst we sit here and acknowledge that absolutely hasn't enabled us to reach our trust target as yet, it really does demonstrate the progress that we've made. And I think with the complexity of this work, that to achieve that amount of improvement in that amount of time is amazing. The individual CSUs that have been involved in cohort 2 have themselves done amazing work too. And this slide shows that all 4 of them have met the target of reducing their individual lead times by more than 50%. Again, that was where they were supposed to get to, and they've absolutely smashed it. So this would be cardiorespiratory, neuro, women's and AMS. And you'll recall that AMS were a CSU that moved from KPO1 into KPO2 to reflect the fact that they needed additional time and support to deliver this this achievement. And wow, they've only gone and done it. So well done to all of you, but particularly AMS. So the other thing that is worth noting is the range of time it takes for our complaints to be responded to has improved. This is quite important. So before the programme started, our complainants could wait anything between 2 and 634 days, 634 days to get a response to a complaint. We've really reduced that range now. It's still large, but it has come down to 403 days. So again, it just gives you a different way of looking at the data and seeing the improvement there, which is brilliant. So one of our aims was around timeliness when this improvement programme started. The second aim was actually around quality. We wanted our complaint responses to be of a high enough quality that actually people felt satisfied by them, and we measured that by considering the number of complaints that reopen for reasons that we can influence. So this would be things like we haven't answered the questions, or the information we've given isn't correct. Now, our baseline measurement for this at the beginning of the programme was 45%, which meant that 45% of complaints that reopened because of something we hadn't got right, which is massive. I'm really, really pleased to tell you that with all the work we've done around trying to improve complaint responses with the CSUs, over the last 14 months, this is now 14%. So I am personally delighted, because I absolutely know how challenged the CSUs, how challenging the CSUs find response writing, and the amount of work that's gone into to supporting them with that. Incredible. Next slide, please. So what have we been up to since we last reported out? So one of the major things we've done is deliver a complaints conference. Our aim, one of our objectives for doing this was around sharing the learning from the KPO cohorts that have gone through, and also sharing the learning that we receive from complaints as an organisation. As you can see, packed programme. Next slide, please. But this is what I really wanted to show you. We have been organisationally incredibly busy, and we had 181 internal delegates on that day. That is totally astonishing in my view. The average time people spent on that call was 3 hours. One of the aims of our project has always been to try and improve engagement of doctors in this work. We had 41 doctors in attendance that day and 46 nurses dipping in and out of that programme. The feedback was incredible. It was very positive on the whole, and the bits that were less positive has given us lots of room for understanding what to do next year round. But my main point here was to pull out that actually the feedback from the conference echoed the whole time the same feedback that we've had throughout the whole improvement programme, which is that staff are seeking information around how to manage the complaint process, feel poorly prepared for it in the organisation, feel they need more support to understand how to engage in the complaints process, and are really seeking where to get this. So we've done a big piece of learning. We want to spend the rest of the few minutes we've got on this report out just describing how we've moved forward to support the organisation in a different way in that respect. And I'm going to pass you over to John because he's done all the work on this and absolutely deserves the credit for it. So over to you, John.
Thank you very much, Christina. Next slide, please. Yeah, thanks. One of the key components of the improvement programme was a focus on the coaching and training of staff who are predominantly involved in complaint management, with all the teams involved in the programme to have coaching sessions with a focus on investigation of complaints and also response writing. It's important to know this is also a learning curve for the complaints team. And utilising a PDSA approach, we understood what worked for the teams involved, following their feedback, and we now have bespoke coaching sessions that can be replicated and also adapted for different staff groups. And so, and this has been a really important element for us. To date, we've delivered about 20 sessions, delivered to about 190 members of staff. And by this afternoon, this number will have increased as I'm doing a session to the respiratory quality forum to deliver a similar session as well. So I'm looking forward to that. Each session focuses on the key principles of our learning in the improvement programme on how to investigate a complaint and what is required when writing a response, which can also be shared with their colleagues after each session. Importantly, we've developed the complaints intranet site, and that's in constant development to ensure that we've got resources there to guide teams on how to investigate and write responses as well. Please take a look if you have a chance. It's very straightforward, it's very practical, and it's easy to read as well. So slide 2, please. Well, the next slide, please. So the coaching programme inspired the complaints management team to consider how we can provide a more formal complaints programme within the trust. Ultimately, we have worked with a company called AKD Solutions to develop what we consider to be an extremely exciting programme. Their philosophy is to stimulate brilliance, and so it fits perfectly with what we're trying to achieve in inspiring our magnificent staff involved in complaints management. So they bring to life the really important elements, and we've got a 2-year plan funded by the nursing CPD budget. And we've invited all the senior staff in the current teams involved in the improvement programme and also the oncology CSU to take part in the training with the aim to equip all participants with additional knowledge, skills and importantly confidence in complaint management and to incorporate a train the trainer approach. We are also hoping to host dedicated sessions for doctors, and I need to progress discussions with the medical education team as well in regards with that. Next slide, please. So this is the training programme, the training modules. It consists of, also includes in-house training via organisational learning. We've also produced a training brochure with the catchy title, Got It Wrong, Put It Right, Make It Better, to promote the course with a forward from Lisa Grant as well. So the mediation skills focuses on the development of core skills needed to resolve complaints at an early stage. If we can stop them before they even become a complaint, that's great. That's absolutely what we need to be doing. Investigation skills focus on the skills for a consistent and systematic methodology to investigate complaints, with the end result being that the complainant knows that they have been listened to, taken seriously, and actually believed as well. Getting it right aims to equip those with what is needed to write clear, understandable, empathetic responses that lead to a resolution. And the masterclass is designed to designed for those responding to and overseeing complaint responses with a deep dive beyond the symptoms of complaints to the actual causes of complaints as well. So we've had the first 2 mediation skills training sessions over the last 3 weeks, and they've gone extremely well. Phenomenal feedback already, instantaneous feedback with emails from delegates saying thank you very much. And so we are really excited to host the other sessions, and more importantly, what we need to do is to evaluate the impact on the sessions of complaint management. I'll pass you back to Christina now to describe our plans going forward from here. Thank you.
So the next time you hear from us going forward, next slide please, will be following the launch of KPO3. We are envisaging there are 2 more cohorts of CSUs that we need to put through this programme. And cohort 3 will be the remaining of our bed holding CSUs that have not yet been part of it. And KPO4, which we are planning for early next year, will include the supporting CSUs and those that are less likely to take leads in complaint responses. So once we've completed those 2 next cohorts, all the staff in this organisation will have had the opportunity to be influenced by this work. Our intention, as always, is to continue to spread the learning that we've had from the cohorts that have gone through already, and to ultimately arrive at a place where we have standardised and a structured approach for complaints management in this organisation that is well understood by everybody. Thank you, and that is the end of this report out.
Fantastic, excellent work. Thank you. That's great, Christina. Thanks very much, John. Brilliant work. And what progress, eh? Really, really good. Delighted to see that, and well done to all the CSUs involved, and seeing the progress we've made, and obviously AMS, great to see that specifically. Really, really good. Well done. I'm delighted to move into this next section. I'm going to ask to try something a little bit different now, because what I wanted to do, because we've got a number of Lean for Leaders graduates, please could everyone other than the Lean for Leaders graduates to just turn your cameras off for a moment, because what I'd like to do is get the Lean for Leaders graduates sort of on screen so I can see them all, and just to kind of congratulate you. So we've got, and give me a wave when I call your name. We've got Jamie Patel. I can see Jamie. Well done, Jamie. Fantastic work. Brilliant. Paul Jackson. Well done, Paul. Dan Carlos. Are you there, Dan? Yeah, I can see you. Fantastic. Claire Green. Well done, Claire. Brilliant. Victoria Louise Boardman. You there, there she is. Yeah, brilliant. Well done, Victoria. Excellent. Sue Parkinson. I haven't spotted Sue. You there, Sue?
I'm waving. I just think you maybe can't see me.
Oh, yes. Sorry. Yeah, so, yeah, you are. Brilliant. Well done. Thank you. Dean Legg. Hi, Dean. Fantastic. Well done. Jennifer Phelps. Well done, Jennifer. Thank you. Nice wave. And Saida Kausar. Saida. Yeah, I can see. Excellent. 2 hands. Fantastic. So it is really special, this, because it's not often we get such a strong showing on Lean for Leaders certification. It's great to congratulate all of you. And isn't it excellent to see the different roles that you all play across the organisation, which I think in itself is testimony to how the Leeds Improvement Method and Lean for Leaders stretches across a whole range of different roles, in terms of we've got dentistry, quality, pathology, digital, doctors, pharmacists, facilities management, blood sciences. It's great. It's fantastic. So really well done. I know it's not easy, and it demands commitment, time, effort, energy, going above and beyond. I hope you've all really felt you've learned something from it. And I really hope you're all kind of able to feel like you can put into action what you've learned and continue to do so. Because actually, it's you guys that are going to make the difference in terms of the Leeds improvement method going from strength to strength. And it's the work you do with your teams that is going to make the difference. So as you'll know, only those doing the work can improve the work. And that's absolutely the case in terms of what you are doing and the skills you've now acquired as being graduates of Lean for Leaders. So imagine I'm handing all of you a sort of a virtual certificate, as it were. Many congratulations. I appreciate all your efforts. You should feel really proud of what you've achieved, and don't let it end there. Keep it going. Really challenge yourselves to do more, because you're fantastic to have reached this level. So thank you very much and well done. So everyone else can turn the cameras on now. Big round of applause. Thanks, guys.
Thank you.
Excellent. Now, I am conscious we've done an awful lot in today's report out, and we've packed in a lot, which is great. Some really excellent report out. So we've literally got about 2 minutes for kind of questions, comments. So you better get in fast if we're gonna. So Lisa, straight in there, Lisa.
Straight in there, Julian. Thank you. Just what an amazing report out. Absolutely brilliant. Thank you so much to the partner program. I don't know where you get the time to spend anything, spend your own time with your family. It sounds like you're so busy, and we just couldn't. It's amazing. I'm so grateful to you, honestly, for you, your collaboration, your views. Honestly, brilliant. And the complaints team, brilliant work. And John, I know how hard you've worked with this as well. Thank you to you for leading the training and the coaching and everything else. You do an amazing job, and thank you to the CSUs. So yeah, brilliant work, Julian.
Thank you. Excellent. I'm looking for any other hands, questions or comments. Jenny.
It's really difficult, Julian. I haven't got any. I'm the same place as Lisa is, just completely. That's probably for me the best report out. The combination of the three, that's left me with no questions. Just enormous pride to be part of Leeds Teaching Hospitals where you are. It's just phenomenal. Absolutely brilliant.
Excellent. Thank you very much, Jenny. Just check any other excuse me, any other comments or questions? Well, that brings us just about bang on to the end of report out. So really well done. Thank you so much to those of you, the partner program, really fantastic. The work on complaints and a great cohort of graduates from Lean for Leaders. So really good way to kind of celebrate on a Friday lunchtime. Thank you, everyone. Please join us at the next report out on the 12th of November. These report outs really do matter, so spread the word about them, because it's great to see the levels of attendance we're starting to get here. And many thanks for all of you supporting it. And particular thank you to all our partners. Great to see you all. Okay, folks, that's it. End of report out. Take care.